Well, right now there are 16 clinical trials happening within the NCH Heart Institute. One of those clinical trials is on pulsed field ablation, which one doctor says could be a safer and more effective way in treating patients with atrial fibrillation. Atrial fibrillation, or AFib, is an irregular heart rhythm that can lead to blood clots or even a stroke. And in today's Your Healthy Family, we're talking about how this treatment works.
When a patient has atrial fibrillation,
the heart, instead of beating in a normal rhythm, every cell starts beating on its own, so it just starts quivering.
Dr. Dinesh Sharma says this can form blood clots in the heart and increase the risk of stroke.
Around 20 to 30% of strokes happen because of atrial fibrillation.
Blood thinners can reduce stroke risk by 70%, but not all patients can take them. Another treatment option, catheter ablation.
We go through the groin into the heart and we cauterize the tissue in the heart which think is unstable or causing the arrhythmia.
So using heat or cold,
we create a scar tissue, and this scar tissue acts as an electrical fence.
It blocks abnormal electrical signals and brings the heart back to regular rhythm. It's 80% effective, but has some risks because heat or cold isn't just specific to the heart.
Fortunately, the risk is less than 1%, but there's always that risk. Especially we worry about the esophagus because right behind the heart.
Right now, NCH is studying something new.
There's a technology called pulse field ablation. The preliminary data has shown that it's very promising.
The NCH Heart Institute is one of 30 sites in the world offering pulsed field ablation as part of a clinical trial.
The new technology or clinical trial which we are studying is to use a non-thermal source of energy, which could be very cardiac selective or heart selective. So we are not too much concerned about the organs around the heart.
Not only is it more effective and efficient,
we can do the ablations, like let's say in half the time, and much faster recovery and a lot safer.
Pulsed field ablation works similar to catheter ablation in that it creates scar tissue in the heart, which acts as an electrical fence, blocking abnormal heart signals and bringing it back to regular rhythm. Dr. Sharma says he feels this is the future of how ablations will be performed. With today's Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.